Hi, this is Mahesh Menon.
Hi, this is Smriti Khanna. Mahesh, today I want to ask you something about chronic pain. What is chronic pain?
I remember reading this in a textbook. It says chronic pain is like beauty. You know it when you see it, but you can't really describe it. So the answer is chronic pain is any pain that outlasts the expected period of healing of an injury or a disease. And sometimes chronic pain may happen even without any visible signs of a disease. So any pain that lasts really long in the body, that is chronic pain. Longer than expected, that is chronic pain. And sometimes it may not have a visible cause, that is chronic pain.
And I know that you treat patients with chronic pain.
That's right.
But the patients that come to you, what are some of the conditions that they may have that will lead them to have the chronic pain?
Usually there are people, if I were to break it down into simple parts, I would say there are those who might have experienced some sort of trauma, and that trauma can be physical, mental, whatever we call it, some trauma, and that manifests as chronic pain after, say, an injury that is not healing well. For example, there's something called as CPSP, or chronic post-surgical pain, and this may happen after surgery, and the surgical pain should get better in a few days, but these people don't get that pain relief, and it goes on for a much longer period of time. So this is one type of pain that we're talking about. And there are those who have certain conditions that make them sensitive to pain states, like those with diabetes, those with thyroid
Right.
issues. The metabolic parameters decide how they are sensitive to pain. Some people get chronic pain after an infection, their viral infection, something that can trigger it. And there is another group of people in whom pain may happen and we may not know the cause. And in medicine, we call it idiopathic. And as my professor used to say, it's pathetic for the patient and idiotic on the part of the doctor when you say you don't know the cause.
So, are you saying that you can have chronic pain as a result of emotional trauma also?
There are studies that some people who get severe post-surgical pains have heightened anxiety in the preoperative period. So the emotion can actually trigger pain. So how I look at it is that your nervous system is in a heightened state of unrest, and then something happens. Now the body doesn't know if it is being helped by the surgery or not. All it says is, I have been attacked, I have been cut. And that is registered somewhere in the brain as a traumatic event, and that causes this.
Okay. The other thing that I wanted to ask you is that when patients come to you with chronic pain, what is the experience like for them? How do they describe it?
So I've spent about the last, it's nearing 2 decades now, dealing with people with chronic pain. The first thing that they come in is their guard is up, because they are afraid that this doctor is also going to tell them that it's been in their head. They've already heard things like, oh, it's psychological, oh, stress, hey, and things like that. And they don't think that they're going to be heard. And when we start describing symptoms, they're able to relate, they're able to understand that, all right, this is someone who knows what I might be going through. The second thing is, chronic pain is marked by an impact on the function. In acute pain, when you have pain after, say, an injury or a surgery, you protect yourself, get better, and you repair yourself. But in chronic pain, you may be looking fine, and there is no activity that they can do without invoking that pain. And then that prevents them from doing it. I can't work, I can't go out, I can't socialize. So we call it the different domains of life, and chronic pain affects each and every domain. It affects their mood, it affects their sleep, it affects their sex life, it affects their social life. So chronic pain takes a toll on the person. And that's the expression and that experience that they come to us with. And if I were to look at a patient with chronic elbow pain and just say, it's just elbow pain? No, it isn't elbow pain. It's an elbow pain that's affecting them. So when we give lectures, we always tell the students that a woman who's walked into the clinic, who's a homemaker and who cooks for her children, she doesn't come for the elbow pain because the elbow's hurting. She comes in because she can't make this the chapati or the 6th chapati because her hand starts hurting and she can't function at home. So that is the impact that we talk about.
So, a lot of functional impact then.
Impact on activities of life, on life itself. Yeah.
And what are some of the treatment options that these patients can get? How can they get treated?
So chronic pain resides largely in the nervous system, all the way from the neurons. I give this example that if you have an injury, if you have a mosquito bite at night, you're sleeping, you don't realize it because your body says, I don't want to wake you up for this. I can put up with this. But if you have a bigger injury, your body overrides all the sleep impulses and wakes you up. So your consciousness registers that pain. So till the pain touches the brain, it's not pain. And in chronic pain, it's exactly that. All elements of your nervous system are activated because of chronic pain. So if I were to just look at the periphery and just focus on getting the knee better, it may not work. I have to get the knee better. I have to restore function. I have to enable them to do activity. So we shift goalposts. And we tell them, I won't say stop focusing on the pain, of course. I would say, let us take our focus onto what you can do. You were able to climb 10 stairs yesterday, today is 20. That's a win in my book. And then the patients start looking at this and they start improving on that. Then there are people who are able to rehabilitate themselves completely. In terms of the rehabilitation aspect, we have to focus on medications and non-medical measures. So the medications, there are a set of medicines that we use in chronic pain. And the non-medical measures, there are different techniques. We have to incorporate some amount of clinical psychology. I have had people with cancer pain telling me, I have cancer pain, I'm not mad, so don't refer me to a psychologist. However, what we try and do is we involve that to help reduce the burden of pain. We use functional measures like exercises. And there's a whole gamut of things that we can do it's not popping pills alone that can help. And then we come to an advanced procedures that we can do like injections, nerve blocks that reduce the burden of pain and help us get back to recovery.
So if there is someone here listening who is going through chronic pain, what would you advise them?
So some of my favorite lines that, every doctor has a favorite lines that they use after years of practice. So one of the things that I tell people who come to us with chronic pain is that don't lose faith in your body. Sometimes it feels like, your body is giving up on you and it feels difficult. But there is a way out and we can help you with it.
Is chronic pain curable?
Sometimes our definition of cure means zero pain, zero pain as 100% pain relief. Now, if we understand that this is a neural system that is trying to alert you to protecting you, it is like asking a doctor, give me glasses with which I can see only good things in the world. I don't want to see bad things. But that's not the case. Whatever registers goes in. So now your nervous system has already registered this as a part of your life. So we don't look at the cure per se, we look at reducing, minimizing, and then the body cures itself. So I have to empower the patient who's going through this and tell them that you have to become the person you were, and our role is to facilitate that healing. So when it comes to chronic pain, I feel that doctors are just facilitators and we are not the healers.